Welcome back to Rural Health News, this segment of Rural Health Today, where we'll fill you in on the latest in rural health headlines. We'll cover 3 headlines in today's episode: what's most urgent, a rural health damage report, and a success story to send us into the week. First, what is most urgent? The first significant impact from the One Big Beautiful Bill is scheduled for the end of 2025, when enhanced premium tax credits are due to expire. These tax credits exist to support the Affordable Care Act marketplace enrollees with financial assistance to offset out-of-pocket premiums and those payments made on those premiums. Next year, KFF estimates a 114% increase on average in out-of-pocket premiums for these enrollees. The exact losses will depend on, of course, income levels, and will make many families ineligible for financial help that currently depend on this service for health care. We expect to see a significant decrease in the Affordable Care Act marketplace enrollment starting earlier in the year, but even yet this month. Since many enrollees are probably already logging on in the first few days of the open enrollment period, they're going to see that their premiums are much higher. Cycles start this way, with more people dropping their marketplace plans, forcing the premiums for enrollees to increase even more, and so forth and so forth. This payer shift will have long-term effects on the sustainability of hospitals and healthcare providers that need the reimbursement that the marketplace plans provide in their respective communities. According to KFF Health Tracking Poll, 78% of adults say Congress should definitely extend the enhanced tax credits for people who buy the marketplace insurance. We're seeing some of this ongoing effort to suspend this crisis as a result of the federal government shutdown, but it will continue to threaten access to healthcare across the country. We'll be watching this issue very closely to report updates on future episodes. And for today's damage report, we'll look at how the shutdown of the federal government is impacting healthcare. One of the areas is food assistance and food insecurities. Food benefits is one of the areas that our nation's communities are hurting the most. We can look at any community across the United States, and in those communities, there are pockets of individuals that have no food or access to food. As long as the government is shut down, the SNAP program, as it's called, which provides food assistance benefits similar to what we understand as food stamps, essentially does not exist. That means nearly 42 million Americans aren't getting the food and the help that they need to feed their families. Food insecurity is already a pressing concern for rural counties especially, and many hospitals are seeing drastic increases in their patients' need for food assistance. The longer the government delays reopening the government, the more desperate our rural communities will become. The largest impact to hospitals comes from the DHS cuts and Medicare payment adjustments. As of October 1st, 2025, Medicaid disproportionate share, or as we call it, DSH, DISH funding, allotments were reduced by $8 billion. Some states are facing more severe cuts than others, depending on CMS imposed guidelines around uninsured population percentages, as well as schedules set by each state's respective Medicaid program. While Medicaid and Medicare are still reimbursed during the shutdown, some important programs halt proper payments to our hospitals. Any hospital that qualified as a Medicare dependent hospital loses its qualification because of the program expiring and must apply as a sole community hospital status if they want to receive similar benefits. The Medicare Low Volume Adjustment, or what we call the LVA, that program has been reverted to requirements from 15 years ago prior to fiscal year 2011. These archaic requirements disqualify many hospitals from this program by narrowing the criteria and cutting off hospitals that need the reimbursement adjustments that the LVA was providing. Even if a hospital does qualify under the old criteria, they were required to submit a request to remain in the program, get this, by September 1st, which has come and gone long before the government shutdown. We've never needed a success story more than ever, but there are still great things happening in healthcare. Most maternity health news has been bad news for the past few years as birthing centers and OB programs find it more and more difficult to survive in this environment of funding cuts and resource shortages. According to the Commonwealth Fund, more than 100 rural hospitals have closed their labor and delivery units in the past 5 years. That is beginning to accelerate now again here in 2025 and anticipated during 2026. However, their new report that some rural hospitals are still doing everything they can to ensure their maternity care can thrive. Here's a glimpse on how these rural hospitals, including Hillsdale, are defying the odds. The hospitals maintaining their maternity program share several things in common, including hospital leadership that remains committed to serving mothers and their babies. As any hospital leader knows quite well, though, it's not enough just to care. When rural hospitals keep the doors to their birthing units open, it's because they've planned ahead, secured resources, and kept their program rooted in the community. We'll link the study in the show notes, but there are a few of their key findings. Sustainable birthing centers in rural areas have a variety of similar characteristics. They have leadership that gains community buy-in and local control over hiring, promotes the continuity of care and policy change to benefit maternity care access. That means going to Lansing and Washington and advocating for programs in those rural communities that support the continuation of OB, such as OB stabilization for the state of Michigan. Leveraging medical residents and engaging specialists sparingly. You can't bring them all here at the same time. You can't be overwhelmed and saturated in the market. We prepare hospitals to handle those obstetric emergencies. How do we address those when they come in the front door? And they take the long-term health needs of local mothers and babies into consideration, resulting in services like mobile maternity health and community education, centering programs, and the list goes on and on. So in light of all of the bad news, there is some good news. And the good news is that hospitals across the country are fighting every day to keep open their obstetric units, to ensure that moms and babies are well cared for, and that this portion of our population does not have to travel hours to receive the care that they most deserve. Thank you to our sources for this episode, KFF Health News, The Hill, Forvis Mazars, and the Commonwealth Fund.
Thank you for listening to another episode of Rural Health Today, the podcast where we connect you to what really matters in rural health. Rural Health Today is a production of Hillsdale Hospital in Hillsdale, Michigan, and a member of the Health Podcast Network. Our host is JJ Hodshire, our producer is Kirsten Newlon, and our audio engineer is Kenji Ulmer. Special thanks to the Hillsdale Hospital marketing team. If you want to submit a question for us to answer on the podcast or learn more about Rural Health Today, visit ruralhealthtoday.com.